covering the stories that impact your life, your town, your state, and your future. This is the Means Report with your host, Brad Means.
Hello, everybody, and welcome back to the Means Report. We certainly appreciate you spending part of your day with us, where today, since it is January, we figured it'd be a good time to talk about New Year's resolutions. And we're approaching the end of the month. Good time to assess how we're all doing and hold ourselves accountable as we try to stay on the right track to improve whatever parts of our life we think need improving. And I hope that you are sticking to your resolutions. We're also going to take a look at your overall mental well-being and how we can live our best lives in that regard throughout 2024 and beyond. And of course, we'll wrap up the Means Report, as we always do, with ways that you can stay in touch and help us get more great guests like our guest today. Dr. Tracy Casanova, returning to the Means Report after about a couple of years, a psychologist at the Georgia Cancer Center. Dr. Casanova, you're the Associate Professor of Psychiatry and Health Behavior, the Assistant Dean of Learner Well-Being at MCG at AU, and so you're very busy, and I appreciate you being here.
Welcome.
Welcome back,
Thank
in
you.
fact. It's been a quick 2 years, hasn't it?
It has.
Let me ask you about New Year's resolutions in general, because many of us make them and try to stick with them. Do you think resolutions in general are a good idea? It seems like sometimes it applies too much pressure to us.
I think having goals in general is a good idea, and being intentional about those goals. And goal setting at any time of the year is a good idea. But the beginning of the year is just a nice time to maybe reflect on the past year and think about all that you've learned from the past year and be intentional about what you want to do with the coming year.
All right. So what does that intentionality look like? Is it a matter of just getting out of bed each day and reciting or reading those goals so that you can go after them?
Yeah, it's good to have a framework when you're setting goals. So one that I like to use is called SMART goals. And so that stands for specific, measurable, achievable, realistic or relevant, and then time-based. Mm-hmm. And so you kind of want to start with your values. What is important to you? Because we're not going to achieve goals that aren't meaningful to us and don't connect to who we are as a person. So we have to want to be active. If you think about, a lot of people set activity goals for the year, exercise goals, but that has to be important to us, and we have to figure out why that's important to us. So maybe that's related to a health concern or just wanting to get out with dogs or kids, but finding a connection is really the first piece in setting goals.
I love that framework. Okay, so let's look at the realistic part. Would an example be, because you're right, so many of the resolutions deal with one's personal health, be that physically or financially. So physically, you might not want to say, I resolve to lose 100 pounds this year. Yeah. Instead, I resolve to eat healthier and exercise a little, and then you just build.
So if we say eat healthier, though, what does that mean?
Right.
We have to say specific things. Does that mean I'm going to eat so many vegetables every day or so many servings of vegetables every week? So that's that measurable piece. For me, last year, I started swimming in the mornings, and my goal was just to go swim 2 days per week.
Okay.
So if I was doing that, I achieved my goal. And that was very measurable because I knew 2 days per week.
Did you ever get to the end of the week and then have to do two back-to-back?
This is another piece of the specific, I picked Tuesdays and Thursdays.
Okay.
So I knew I was going to swim on Tuesdays and Thursdays. So that was also working it into my routine and making it a habit as well.
All right, so let's just say we have worked within this SMART framework that you've described. How often should we hold ourselves accountable? Is it every day? Is it every week? How often should we check in with ourselves?
Every day, every week, it depends on, is that goal just for the day? Is the goal for the week? Is it for the month? It's also good to tell friends and family about our goals so other people can hold us accountable and maybe build us up as well, or even having a partner to achieve goals together, especially if we're thinking about like an activity, physical activity. Having someone to do that with can make it a little bit easier.
What do you do, and maybe this is the most appropriate question for the end of January, when you hear that people typically might start to take their foot off the gas when it comes to their resolutions. What do you do if you slip to keep from quitting?
Yeah, knowing that just because you didn't make it 1 week, there's another week. Maybe you didn't make it one day, tomorrow is a new day, and maybe reevaluating, maybe it wasn't so realistic. Maybe my schedule just doesn't allow for these activities that I wanted to do, or maybe financially I'm not able to reach that goal that I wanted. So taking a step back, reevaluating, seeing what's realistic and what could actually fit in someone's lifestyle.
How does your mindset or attitude play into all the things you're talking about? And does that willpower vary from person to person?
I would say more mental flexibility and maybe some self-compassion, being okay if you do slip up. It doesn't mean you've completely failed. It just means you need to try again. If you've achieved, you exercise one day and you meant to do two, you still did one day. And so being kind to yourself, and maybe even thinking about if someone else slipped up in this way, would I be kind to them? Because a lot of times we are kinder to others than to ourselves.
At the end of the day, is it all about replacing bad habits with good ones? Is that a simple way to explain resolutions and goals?
I think it is, because when we try to stop doing things, it's not always helpful. We want to reward ourselves for doing something different, something healthier, something in line with our values and how we want to live our lives.
What kind of goals do you see people setting out there these days? Is it, as we mentioned, mainly financial and physical, or do you see others?
I think there's a lot of health-related goals in particular.
Yeah.
It could be relationship-related goals. Maybe there's a relationship in someone's life that they want to invest in more. Maybe there's a family member farther away that they want to make sure they're calling more. So I see a lot of financial, relationship, health.
What about obstacles or barriers that might be in your way? Is it a good idea to plan ahead for those?
Yes, that gets to the specific. We want to anticipate all of the obstacles that could be happening. Again, if kind of going back to exercise, if I think about I want to exercise after work, well, maybe I work late sometimes.
Right.
So I need to anticipate what am I going to do if that gets in my way and have an alternative plan. We really want to plan ahead, because when we run into barriers in the moment, it'll be very easy to give up and say, I don't have time for this. But if we know ahead of time an alternative route, that can be helpful and more successful.
All right, last question on resolutions before we take a quick break, and that's just, do you think we should renew them each year and build on them year after year so that whichever categories of goal setting we choose, they just improve as we age and go through life?
I think every year it's great to reevaluate your goals from the previous year and see what fit into your life. Maybe your values have changed over the last year. Lots of things can change in a year: jobs, relationships, financial status. So every year, or even if you wanted to do it more frequently, kind of giving yourself a check-in halfway through the year could be a good idea too.
All right, well, we're going to continue to talk with you, Dr. Casanova, about your work. Not only when it comes to keeping resolutions and setting goals, but the wide array of areas that you cover in your daily life. You're doing some exciting stuff, and we want to check in with you on that. So we appreciate it. And our conversation with Dr. Tracy Casanova will continue in just a moment. Welcome back to the Means Report. We are continuing our conversation with Dr. Tracy Casanova. She is someone with many responsibilities. You heard me read her titles at the top of this broadcast. One of them, Dr. Casanova, is the Assistant Dean of Learner Well-Being at MCG at AU. What does that mean? What do you do in that regard?
Yeah, I work with mostly medical students, some of our residents at AU, and I work with them just on that, on their well-being. So that might be meeting with them one-on-one if they're struggling, helping them get connected to resources like our counseling center or even financial resources, and then doing some kind of overall checks of all of the students in general and making sure the culture that we have at MCG promotes well-being.
All right, my undergraduate sons have resources at their respective universities that allow someone to monitor their work and make sure that it's being turned in on time and that it's up to the standards that it needs to be. Are you doing that, or is yours more just their psychological well-being?
Mostly psychological well-being. We do have a whole team in student affairs that supports the students in the way that you're describing. But me personally, I focus on their well-being, which has a lot of factors. It could be physical well-being, emotional well-being, spiritual well-being, financial well-being, environmental. There's all different kinds of wellness and well-being that encompasses somebody.
How are our future medical professionals doing? Are they stressed?
Unfortunately, medical students across the country are stressed, and more stressed than other kinds of students in the general population.
Why? The workload?
The workload, I think kind of the culture of the profession, anyone in a caregiving profession is going to be more stressed, especially if you think about the last couple of years when it comes to healthcare.
Yeah.
Taking care of others puts a lot of stress on people.
Yeah, speaking of, I know one of the projects that's near and dear to your heart right now has to do with caregivers, especially those who are tending to bone marrow transplant patients. Tell me how this whole thing started and how it's going so far.
Yeah, so at the Georgia Cancer Center, we have a lot of bone marrow transplants that take place. And part of that process is going through a psychosocial evaluation with our psycho-oncology team. And that's just where we check on a lot of different psychosocial factors to make sure they are supported and they are ready to go through the stressful bone marrow transplant process.
What is it like for the families who have to endure that? I know the patients, obviously, they're the focal point, but what about those who are trying to care for them during that time?
Yeah, to go through a bone marrow transplant, it is imperative to have a caregiver because it is a very stressful procedure that can, at times, get you feeling very sick. And so you need someone there to make sure you're okay and take you to appointments and monitor any kind of emergency situations.
So what does that look like on a day-to-day basis, and what sort of advice or resources do you have for those families to help them get through it?
Yeah, so we have grants. We don't personally have grants, but we get them connected to grants. We also have counseling services for patients and families that need support during that stressful time. When they are in the hospital with us, our team can also meet with them to support them emotionally as well.
What does a bone marrow transplant do to someone? Just in my limited knowledge of it, it seems like it just sort of erases and resets your entire immune system.
Yeah, they use the bone marrow transplant for people that have blood cancers and blood disorders. And the idea, and there's different kinds of transplants, but the basic idea is to wipe out the immune system that is diseased and to introduce a healthy immune system.
So, when that happens, is it the caregiver's responsibility to protect them from every single germ that's out there?
Not exactly. There's a period of time where they will be in the hospital with us during the transplant initial recovery. And then when they go home after the transplant, it is important for the caregiver to make sure, they're washing their hands, everything is clean, making sure food is very clean, preventing any kind of infection. Of course, we can't prevent everything, but it's to their best of their ability.
How long do they have to do that? How long until the patient's able to stand on his or her own a little bit when it comes to being immune to things again?
Yeah, it really depends. Every patient responds differently to the treatment. And so some of them are okay, they can be active, they can care for themselves right away, and some are more sick afterwards. And it really just varies patient to patient.
We talked about the burden of stress that your med students face. What about these caregivers? Have you had an opportunity at this point in your studies and your research to hear from them? And if so, what do they say to you about what life is like?
Yes, we have not started interviewing previous caregivers so far. The research right now has been mostly focused on white female caregivers, which isn't representative of the patients that we serve at the Georgia Cancer Center. So the goal of our study is to talk to our diverse caregivers about their experience going through the bone marrow transplant process and what it was like for them to serve as a caregiver. So then hopefully we can support future caregivers better.
What do you do, and this is just caregiving in general, I guess, it's not bone marrow specific, but what do you as a caregiver do to deal with perhaps the guilt that could come with caregiving? Not only just the guilt of why is this happening, and did I do enough to maximize my relationship with this person before they got sick?
I think I see a lot of caregiver guilt when it comes to, it's stressful, right? Caring for others. And I think they feel bad when they're like, I'm stressed, I don't wanna be doing this all the time. And then that guilt comes in, like, I should be selfless. I should be able to do this without complaining, without being upset. But they also need to take care of themselves and acknowledge that those feelings are normal. It's okay to feel a little resentment at times. That is a normal feeling. that just means it's time for the caregiver to go take care of their own needs, and hopefully, if possible, tag someone else in for a period of time, finding someone else that can help with those caregiver responsibilities while the caregiver goes and takes care of their own well-being.
What kind of resources do y'all have to help with that? Do you have places where we can perhaps leave our loved ones for, I don't know, half a day or something to get that break you talked about?
I would say, unfortunately, that is a gap in our healthcare system, and we don't have those kinds of supports. At times, if there is a more severe procedure and someone is in a rehab facility, that could be a time that there might be a break, but that's not accessible for everyone. And there are some caregiver support groups, online type support groups that people can reach out to and connect with.
What about cancer treatment? How is that going? Are we reaching everyone we need to reach in that regard? Is everyone being served from a medical standpoint?
I think we serve as many patients as we can.
Yeah.
I think we're always going to miss patients at times, but I know the Georgia Cancer Center is doing a lot of initiatives with preventative care and early screenings to try to reach as many patients as possible. And then also, if we catch them early and prevent, that's really the goal.
Any disparities in cancer treatment that you've noticed when it comes to different segments of our population?
We see a lot of disparities with types of cancer. That is a whole area that we could talk at length about, but there are differences in types of cancer that different groups of people get.
So how do we improve that access? How do we get more people to the doctor? Or is the case post-pandemic, get more doctors to the people?
Probably both.
Yeah.
Yeah.
And what's would you say to someone who's watching this perhaps in a rural area and says, you know what, I don't feel right, but I don't have a car and I can't get to Dr. Casanova and her team. How do we help those folks? How do we reach them?
I would call the Georgia Cancer Center and get connected to resources, and hopefully we would be able to let them know if there was anything in their area, or even if they can get to a primary care doctor or somebody locally that would hopefully be able to connect them to resources.
You know, I asked you it was either the beginning of this segment or toward the end of the last one about the well-being of our students and your efforts in that area. What about the psychological well-being of Americans these days? How's our nation doing when it comes to mental health? It seems there's not a night on the news that we don't do some story about mental health. How do you think things are going in that area?
I think they could be better.
Yeah.
I think when I think of disparities between health insurance support and mental health insurance support, there's a big gap there with not all insurance programs supporting that. And then we need more providers. There's definitely low mental health providers, and we need more people going into the mental health profession.
Any advice when it comes to people who are trying to cope with their own mental health? Anything we can do on a day-to-day basis to make ourselves feel better?
I think having social support is really important, and knowing that people care and reaching out for help when someone is feeling down. I think a lot of people turn inwards and keep things to themselves, and even just talking about something helps relieve that burden.
Well, I hope that your work continues to go well, Dr. Casanova. It's impressive, the wide array of areas that you cover. Did we cover everything today? Everything good on your end as far as the topics that we tackled?
I think that we covered some great topics today, and there's always endless topics that we could cover.
Yeah, are you glad you decided to become a psychologist?
I am, yeah.
Why? When is that moment when you go, thank goodness I chose this career?
I think every day when I just enjoy what I do and don't question there's no other job that I'm like, I wish I had that job. I'm very happy with the career path that I chose.
Well, it's a good one, and you're helping a lot of people, and I appreciate that more than you know. So thanks to you and your team, and appreciate your time again today.
Thank you.
Absolutely. Dr. Tracy Casanova, our special guest here on the Means Report. Reach out and take advantage of those resources that she talked about if you're struggling in a mental health capacity, because they're out there and folks do want to help you. When we come back, we're going to let you know how you can help shape future editions of the Means Report. It is easy to do that. We will give you all of the details when we come back.